Pharmacists at OSU Wexner Medical Center make an exciting discovery. They found extra doses of the COVID-19 vaccine in vials delivered to them. But are they allowed to use that? Thanks for joining us tonight at 5. I'm Andrew Kinsey.
And I'm Yolanda Harris. Today we spoke one-on-one with a pharmacist who made that find.
This is the overfill left from a vaccine administration clinic this morning.
Now, each vial is supposed to carry 5 doses, but they found enough for 6 to 7 doses, and that could go a long way. But that's not how the federal government ordered the vaccine to be used.
The drug is labeled to withdraw 5 doses only.
Now, healthcare workers nationwide threw out the extra doses. The pharmacists didn't want that to happen, so they went to the chief clinical officer who took the concerns to the state.
I think we will be able to use it. I actually give a lot of credit to the Ohio Department of Health. From what I understand, they really put some pressure on the CDC, who I assume also put some pressure on the FDA to say, we can't be in a situation where we potentially have 6 or 7 doses of vaccine per vial and we're only using 5.
Now we're told drug makers typically overfill vaccine vials in case of spills and other waste. And when it comes to that extra vaccine, we heard from the governor himself addressing that today.
10 TV's Brittany Bailey is live with his message and more for the state. Brittany?
Well, this has certainly been a week of positive news when it comes to the COVID-19 vaccines, and that positive news continued today when we learned that we're going to get more than we bargained for likely out of those Pfizer COVID-19 vaccines just shipped this week.
Our instruction to everybody, I'm going to make it very, very clear, is keep going. You know, we do not want to, this is like, you know, you don't want to spill any of this. This is so valuable, and we don't want any of it lost.
So as we mentioned earlier, each vial is supposed to carry 5 doses, but it turns out healthcare workers may be able to safely get up to 7 doses out of each vial. Now, the only caveat here is that they have to be full doses. They cannot pull a half dose from those vials. Now, this news, of course, comes as we still face high COVID-19 numbers here in our state. The governor did say today, though, there is a slight other bit of good news, and that we didn't see quite the big Thanksgiving bump in cases that we expected to see. He attributes that, in part at least, due to his 10 p.m. curfew still in effect through the beginning of the year and the enforcement of mask-wearing policies. Now, coming up at 6, we're going to take a closer look at how this pandemic has affected students and their learning both in and outside of the classroom. For now, reporting live in downtown Columbus, Brittany Bailey, 10 TV News.
Thank you, Brittany. Now, we'll need more than one vaccine to fight this virus.
In fact, we will need an army of them. We've learned moments ago that the FDA's Vaccine Advisory Committee has approved the Moderna vaccine. That vaccine is quite similar to the Pfizer one and is just about as effective. Of course, we'll keep you posted on that breaking details about that. And we're always staying in touch with experts about this vaccine, what it means for you and your family. We want to hear from you. Send us your questions so we can get them answered. We know you have plenty of them. Text that number, 614-460-3345. In fact, our Angela Reigert got some questions answered just last night, such as, should I get a vaccine if I already had COVID-19? You can hear the answer right now over at 10tv.com.
Well, as we continue to report the daily COVID-19 numbers every day, we've changed our reporting to tell you the total cases, hospitalizations, and deaths.
Now, here's the reason behind that. The change comes after the state changed to add antigen testing to the entire total. So we want to make sure we're giving you the most accurate information possible each and every day. Today's numbers from the Ohio Department of Health show more than 11,000 new cases. We also saw 370 new hospitalizations and 117 new deaths. The state's positivity rate now 14.4%. And when we look at this 14-day moving average for cases, the plateau we've been reporting is still holding steady around 10,000 cases a day.
And here's something else to keep in mind. Franklin County's stay-at-home advisory has been extended until January 2nd, and that's because of a high number of COVID-19 cases and spread in our community. People are asked to only leave home if they have to go to work, school, or for essential needs. And remember, this, of course, is just an advisory. It's not an order. We've also just learned Columbus City Schools is extending its sports suspension in accordance with this advisory.